Hi, everyone, and welcome to another episode of the STEMS Monthly Minute. Each month, we share a short update focused on practical topics that support patient care and strengthen our EMS system across Allegheny, Cattaraugus, and Chautauqua counties. Last month, we talked about effective handoff reports using the MIST format. Today, we are taking a closer look at one important part of that process, vital signs trends, and what they can tell you about your patient. Vital signs are more than just a number to document. They help tell a story of what is happening with the patient, how they are responding to treatment, and whether they are becoming more stable or more unstable over time. A single set of vitals gives you a snapshot. A trend gives you clinical context. That context not only matters for the treatment decisions in the field, but also for the receiving facility. It helps the emergency department understand what has changed since your first patient contact and where the patient may be heading next. When you are assessing a patient, one of the most important questions to ask yourself is, are things staying the same, improving, or getting worse? That answer often comes with trending vital signs over time. For example, a blood pressure of 100 systolic may not seem alarming on its own, but if the same patient started at 128 and has gradually dropped over the course of transport, that tells a very different story. The same is true for heart rate, respiratory rate, oxygen saturation, glucose, GCS, and, when applicable, EtCO2. Changes in these values can provide early warning signs of deterioration even before the patient looks dramatically different. Trends can tell you a lot. Trending vital signs can help you identify compensation versus decompensation. A patient may look stable at first, but subtle changes in the heart rate, blood pressure, or respiratory effort may suggest they are compensating and beginning to decline. Response to treatment: did the oxygen improve their saturation? Did fluids improve their blood pressure? Did medication improve symptoms? Need for urgency or escalation: a trend may support activating a stroke, trauma, or cardiac alert, or it may reinforce the need for rapid transport and reassessment. Let's look at a simple example. You are transporting a patient with abdominal pain. On first contact, their blood pressure is 118/76, heart rate is 92, and they are alert and talking. 10 minutes later, their blood pressure is 102/68, heart rate is 108, and they are becoming pale and more uncomfortable. Those numbers may still be within a range that does not immediately stand out on paper, but the trend tells you the patient may be getting worse. That is important information for your treatment, your transport decisions, and your patient handoff report. When giving a report, it is helpful to share not just what the vitals are now, but also how they have changed. For example, initial blood pressure was 132/84, now down to 108/70. Heart rate increased from 88 to 112 during transport. That gives the receiving team a much clearer picture than a single set of vitals alone. This is especially important for patients with chest pain, stroke symptoms, trauma, respiratory distress, altered mental status, sepsis concerns, and pediatric or geriatric patients. A few common issues we see include only documenting one set of vitals when more should be obtained, not repeating vitals after a significant change or intervention, reporting numbers without noting the trend, and missing subtle deterioration because the patient still looks okay. Trending vitals help move us beyond just checking a box. It supports clinical judgment and better communication. Vital signs are not just a part of the chart, they are one of the clearest ways to understand what your patient is doing over time. Strong assessment includes not only taking vital signs, but also recognizing what those changes mean and communicating them clearly. Thank you for everything you do each day to serve our communities. If there are any topics you'd like us to cover in future STEMS Monthly Minutes, please reach out. We're always here to help you.